Hello, my name's Chris Winchester and I'm CEO of Oxford Pharmagenesis and an Associate Fellow of Green Templeton College, Oxford.
Hello, my name is Amy Bruce. I am a medical doctor and currently a PhD student at the University of Oxford in the Nuffield Department of Primary Care Health Sciences.
So Amy, we've been doing some really interesting research together. Do you want to say a few words about how we first started collaborating?
Absolutely. So as you know, I'm also a member of Green Templeton College, and it was in this capacity that I reached out to you to find more about what the pharmaceutical industry is doing to address its climate change targets. And that really links into the research that I'm doing at the Nuffield Department of Primary Care, which is looking at how the pharmaceutical industry is reducing its carbon footprint. So I reached out to you. We had a lovely conversation that resulted in the research that we did.
Oh, well, I was so pleased to hear from you, Amy, because it was a topic that we knew was important and we were just starting to grapple with. And the research has really been helpful to us as we've worked out what to take forward. So do you want to say a bit about what we did and what we found?
Yes, absolutely. Well, I think just to premise it, why we were really interested in what the pharmaceutical industry is doing is because if you look at health systems' carbon footprints as a whole, pharmaceuticals fall quite a significant proportion of it. So what we did was we looked at the top 20 pharmaceutical companies' climate change commitments, their greenhouse gas emissions that they reported in their company reports, and what strategies they were really using to reduce these emissions. And we found some quite interesting results, and I'm curious to hear your thoughts on what you thought about it.
Oh, thanks very much, Amy. I mean, we were really very pleasantly surprised, I think, to see how much was happening. Nearly all the top pharmaceutical companies are actively engaging with the sustainability agenda, and you can see that companies are reducing their carbon emissions and by setting some quite stringent targets. And so for us, that was fantastic to see. What did you take from it?
Yes, I think equally I was quite pleased with how many companies have set climate change targets and how many have made reductions, specifically in the emissions from their own operations. I think what I would point out, though, was that there's still a lot of work to be done on their supply chain emissions and reducing them. So we found that only 45% of the companies had actually managed to reduce their supply chain emissions. But that's obviously quite important news for you as a pharmaceutical supplier.
Thank you, Amy. Yes, I mean, that was a really an important point, I think, that you can see in the research that the in-house emissions and energy are coming under control, but the next frontier is really for the suppliers such as ourselves. So, and in fact, that's really fed into our own experience that we started to see our clients now asking more and more about the environment. And we were forewarned, and we'd already done some thinking inspired by this research that led us to invest further in the area and commit to the Science Based Targets Initiative, and also enabled us to be awarded a silver medal by EcoVadis for our sustainability and broader corporate social responsibility. So that was a wonderful way of seeing the research translating through to real-world benefits and real-life changes.
Yes.
So what should pharmaceutical companies be doing to reduce their carbon footprint, and how can they work with companies like ourselves to help make progress?
Well, we can definitely learn some lessons from the research that we've done. So a lot of these companies are engaging with things like optimizing energy use within their manufacturing sites, switching to renewable energy, using electric vehicles instead of petrol or diesel vehicles, using ship transport instead of air transport. As you said, there's a lot of work that can be done with suppliers. So engaging with suppliers on these issues, educating suppliers, building in sustainability into code of conduct. And I think what we really want from this paper is for it to be a call to action for pharmaceutical companies and industries and other industries to see what can be done in terms of climate change, to collaborate on innovative solutions to reduce their greenhouse gas emissions. Reducing our climate change impact is really integral.
And so if people want to find out more about this area, where should they go?
Well, yes. So we've got this article that's been published in the International Journal of Environmental Research and Public Health, so you can access it there. And hopefully there will be more research on the horizon as well.
Thank you very much.
Thank you.